My favorite procedure. Became my favorite procedure though.
Okay.
Because patients truly don't understand the difference between just removing the excess skin that you're doing and this muscle repair. Can you elaborate why it goes in combination with an upper bleph many times?
So blepharoplasty has to do with the aesthetic of the skin and the soft tissue and like how it blends into the brow area. Ptosis is about how closed or open your eyes are. So if you're trying to open the eyes up more, like they look kind of sleepy because the lid with the lashes is actually sitting closer to the pupil, then ptosis involves lifting that up to open up the eyes so that you look more awake.
Why do you turn away some patients that just want an upper bleph but they need a ptosis and you...
Because if you just do an upper blepharoplasty and somebody who needs a ptosis repair also, it can actually make the upper eyelid look taller, which creates more of the sort of sleepy look. So it can actually make them look sleepier.
Okay. So is there patients that can get away without, like it's not necessarily an upper bleph that they need, it's just like this ptosis repair? I have a lazy eye.
So the issue is that if you just address ptosis and you don't address the upper lid, you're basically like, you know, ptosis is essentially rolling up a window shade. So you're getting the window shade to raise up higher, but it bunches a little bit more up top because now you have more skin like in a smaller area. So while sometimes that's an advantage if you're more hollow in that area and you need volume, if you are not deficient of volume, then you get more bunching there and you have to do something to clean up that area. Otherwise, it doesn't look smooth.
Okay. What's another common procedure that you combine with ptosis repair? Because I know now if we lift the curtain, but if someone has some hollowness there.
So fat transfer or filler for the brow, essentially to create more volume in that middle part of the brow and to restore some of that
Makes sense on why you're asking for these photos of childhood. You're looking to see that fullness.
Yeah, so this is why we're looking to see what people look like beforehand and trying to restore as much of that natural aesthetic and shape as we can. Also because when people lose volume in that middle part of the subbrow, it creates more of a, it makes that part of the bone and the shadow start to show a little bit more. If you just remove the skin in the upper eyelid, you can see more of that shadow and it can make the eyes appear more rounded. And that's when people have complaints about the shape of their eyes changing after they've had upper lid surgery, especially when it's just subtractive surgery that involved just removing a little bit of skin. So this is the reason we replace volume at the same time so that you maintain that natural shape. We want to see more youthful almond shapes. We do not want to see the round shape that we're all predisposed to when we become much older, like 80s, 90s.
I love that you're saying that because a lot of these calls that I'm having with patients, like, oh, I already had an upper blepharoplasty. I just don't like how I'm looking. It's looking more hollow. I look different. I look more aged. And would you say that's more older technique?
I mean, we're all predisposed to losing volume in the periorbital area, and we all are predisposed to getting more hollowing in this area over time. Some people, because of genetics and anatomy, tend to show some more of those changes a little earlier than others. If you're removing skin and you're not replacing volume at the same time, you are going to show more hollows and you're going to look deeper. It makes the eyes look darker and it changes the shape of the eyes.
Okay. Okay, essentially kind of like the lower lids. If you're not repositioning, you're going to see that.
If you're not restoring volume at the same time as you're subtracting something, then you're going to see more hollows and it changes the shape of the eyes, or it can make you look more tired. That's what we're trying to avoid. We're trying to keep more light in the areas around the eyes to make you look more fresh.